I think it would be a really great idea if we would go kind of back to the way nursing used to be when nurses trained on site in the hospitals. You know, this nursing shortage is a real thing. I'm lucky that I work someplace and somehow we pull people out of the woodwork, out of hats, from somewhere. And we have a good scheduler and we're very lucky. But, a lot of this shortage does lead to burnout, and it leads to things like, patients abusing nurses and nurses having to stop right after that and take two breaths and go on to the next patient and just smile and do our thing. But if we could start training nurses, they could go in an entry level CNA position. We always need, everybody needs a CNA, and let them get their confidence, let them get their experience, let them get their clinicals, and let them advance to LPN, to RN, and so on and so forth. Because you're just not going to get any better experience when you're outside of the classroom and you're on the floor and you're learning these things and touching and feeling and seeing and smelling. And, I think those just make the best nurses. And also mothers make phenomenal nurses. They're nurturing, they're good at multitasking, they care about people, they're good at sleep deprivation. And I think that if we would make it more accessible by making them less, the programs less regimented, where it's not Monday through Friday with Saturday clinicals, where you can't work and make a living, and just get people, on board with this idea, because it would just change everything. It would just give people such an opportunity, that would be really good at this field. And I just think that, I don't know who to talk to, but somebody should consider, formulating a different type of program.